Hi, welcome back to the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. So a lot of you know, and I've mentioned this in my other podcasts, I'm also a certified financial planner, which people prompts a lot of questions around retirement planning, Medicare planning for my clients. One of the things I'm going to share with you is a conversation I had again this week. It's a common theme around group benefits. And this is for people that are approaching 65, people that are 65, and also people that are retiring, right? And there might be retiree benefits. And it's going to be a couple things I'm going to kind of go chronologically and just share some information with you to stimulate some thoughts, because these are things you really want to be thinking about. The first question is, that I get asked, hey, it's always the same thing. I get an email or phone call, I was referred to you, I'm turning 65, and I'm going to continue working, right? And I'm not sure what I need to do. And a lot of this is based around the limited information that HR provides or can answer regarding Medicare. Because the default answer is, question is, do I need to go on Medicare? Part B in particular, because it costs money. Part A you get for free. Hospitalization, employers and employer group plans want you to be on Medicare. I'll tell you why. Really, the first reason is Medicare, when you have it, especially if you've got a group plan, any other insurance, always becomes your primary insurance. So if you think about Medicare Part B from a group employer or from an employer's perspective when their plans are getting priced, original Medicare, you've got a $283 deductible for Medicare Part B. Anything under Medicare Part B, which is considered medical, has a 20% coinsurance portion that would be subject to your other insurance plan or your out-of-pocket costs. Medicare pays 80, you're responsible for 20. So only 20% of your medical bills that are under Part B go through the employer's plan. So it does reduce the employer's plan costs, especially for older employees. Depending what state you live in, some of these plans are underwritten, some are just community rates. So it may affect you, it might not affect you. But for most people, the concern is, do I need to pay my Medicare premium, right? And I usually come back and I'll say, look, we got to find some information first. We got to find a good source. The best source is getting the actual plan documents of that health plan. Because ultimately in that, if we can get a searchable PDF, we want to look and just search under Medicare and see what comes up. I've seen everything you can possibly imagine under this. I had one client, well, not really a client. Somebody was referred to me. I was helping navigate this. I go, get the plan document, because she wasn't going to enroll for Medicare Part B. HR couldn't answer the question. And I read through the plan document for that group plan. It was interesting what I found in there. And this is not the only time this has come up, because now I'm looking for these things. It states very clearly in there, and there's no ambiguity in the language. If you're Medicare eligible and you're entitled to Medicare, you're required to take it while you're working under this group plan. And here's the kicker with it. If you do not take it, your benefits will be treated as if you do have Medicare, right? I kept reading. What that means is this. You're liable for Medicare's portion of your medical, 80% in this case. So you want to be really, really careful. Find it in writing, right? Are you required to take it? Before you say I'm not, make sure of it. Usually a lot of large group employers, the larger plans, they don't require you to take it. But if you're in a medium-sized company, corporation, you want to be careful with this. You want to find out specifically, get it in writing. Are you required to have it or not? Now, if you, again, are required to have it, then Medicare becomes your primary. You sign up for it. I've had a couple people that have had plans. I just looked at one, believe it or not, yesterday. And somebody that was referred to me from this dentist's office, was panicking. They're going to be retiring. And I said, we got time. Don't worry. We're going to kind of handhold you through this process. So the first thing we need to look at is, when are you going to retire in relation to when you turn 65? Let's look at your current plan. Let's also find out, do you need to enroll Medicare or not? Now, we couldn't find in writing that stated whether you did or didn't. The employer just said you needed to be enrolled in Medicare once you turn 65. I said, let's just be safe and say, okay, we need to do this. That's the recommended path. Just get it. You can always go on Medicare off of a retirement plan or off of a group health plan, assuming it's credible coverage with Medicare. Any point in time, there's no penalties. A lot of people think I've got penalties if I don't enroll Medicare. Not if you're covered. You don't have to do it if it's not required. So we went back and said, okay, let's assume we've got to do Medicare. Let's look at this group plan. And even post-retirement, this person had a horrific experience calling their benefit administrators because they do have these options. And a lot of employers require you to go through the agencies they have relationships set up with if there's any type of medical reimbursement account or health reimbursement account. So you've got to be careful because once you leave a group plan, in most cases, you can't go back. And if you do get money every year towards your benefits, you'll lose that in most cases. So in this particular case, there is no money given. They could go back if they left it, but I go, let me really analyze this group plan that you have. And I was actually quite surprised what I found in the details. And I went through all the benefits. And I had a call just yesterday with this person. And I told her, I go, here's my advice, because usually I can make a pretty good determination what's in your best interest. Give you a couple facts with this group retirement plan. First and foremost, it had pretty low copays, very low. I mean, we're talking $30 for a specialist. It's a PPO. It's a great plan. Great benefits inside of it. The out-of-pocket max with this plan, it's not a deductible. There's a very, very big difference between deductible and out-of-pocket max. Every time I go over this, people get those confused. A deductible, you pay it first before your benefits kick in. This didn't have it. It had an out-of-pocket max of $1,500. That is the catastrophic loss in a calendar year for your medical benefits, right? $1,500. Now, as I read through this, I was surprised by this. There's no drug coverage. So this is not considered credible coverage by Medicare. And I explained to her, you're going to have to get a standalone Part D plan. They vary state by state. The cheapest one in New York is around $35 this year. Outside New York, $0 you can get them for. And it really depends on your prescriptions. Not all plans are the same. So be careful with that. So I said, you're going to have to get a separate Part D plan because it's not included. You're going to have to pay for that. And I kind of explained the differences, Medicare Advantage, supplemental, the cost, the pros and cons. I said, look, here's what I would do. And this is the same advice I'd give my own folks, and I treat every single client like they're my own parents looking at this. You've got a $1,500 cap. That's your max out of pocket for the year. It's pretty low. You get into a Medicare Advantage plan. There's a lot of insurance agents that want to convince you to do this. You could be looking at, on average, around $9,000 out of pocket max for a calendar year. Now, you have original Medicare. That pays 80% under Part B. You also have 20% co-insurance on your Part B as well. So at 20%, even your doctor's office visits, we estimated likely she's not going to hit her $1,500 out-of-pocket max, but that's a cap. Once she hits that group plan steps in and pays 100%. It's a great deal. So I said, keep that plan. That's a phenomenal plan because we don't know where Medicare is going to go. The costs are increasing at a very high inflation rate. Medicare supplemental plans are getting more and more expensive. Definitely state by state, those costs are going up. But we know with this right now, it's a great plan. There's low cost to you for it. It's going to work extremely well with your Medicare, and your financial exposure is really, really low with this. So in that case, that plan worked really, really well. I said, keep it. It's a great, great plan. I've had some people, I had another gentleman yesterday, as a matter of fact, call to make a second appointment. He's got a surgery coming up, high-deductible health plan. And he's going to keep it because his wife isn't 65 yet. She needs to be covered for another year. Decided, you know what, I'm going to pick up Medicare, even though I've got this group plan. There is an integration of benefits with this. That $17,000 deductible he will have to have paid out, 100% of that for surgery he's got coming up. I said, here's the alternative. You go on Medicare, you pick up a supplemental plan, right? In New York State, we're north of $300 a month, but the surgery is 100% covered. So we factor in the cost of Medicare, supplemental plan, And even for this year, it makes 100% sense because $17,000 is a heck of a lot of money when we're looking at a 6-month period. I said, so even over 6 months, when we factor in you're going to have to pay in Medicare, you're going to have to pay for the supplemental plan, drug plan, it makes sense to do it because he's going to save thousands and thousands of dollars. So you want to be careful of those high deductible plans while you're still working. Medicare a lot of times is a better option. One of the things I just thought I probably should mention with this. Some states, when you turn 65, you got a guaranteed issue period for a year with supplemental plans. If you don't take a Medicare supplemental plan that first year, you could be subject to underwriting. You could be subject to guarantee issue rights. So you want to be careful with this. New York State is very, very different. And a lot of people on the internet, bashing, they call Medicare disadvantage plans. You got to look at it state specific because it's not always the case. When you look at underwriting pre-existing, a lot of times with Medicare in New York in particular, as long as you don't go without 63 days in a lapse of coverage without credible coverage, there's no underwriting, there's no pre-existing conditions. That's not the case in most of the country. So these are things you want to think about transitioning off of employer group health plan. A lot of people do find they save money. A lot of people don't. And you don't want to make the mistake of leaving an employer group health plan, just signing up with an insurance agent and losing a health reimbursement account. Some people are getting $1,500, $1,800 a year towards their health benefits. That's gone if you don't choose what's available. It's not an easy decision. The best advice I can give you on this, you want to talk to somebody that knows what they're doing with this. Double check the advice they give you. There's a lot of insurance agents out there dabble in Medicare because what they're trying to do is bring you in to sell you other products, trying to get you into the business. There's financial advisors I've seen they're trying to do Medicare. Again, it's a great way to open the door and start a relationship. Find yourself an expert that knows what to look for, the questions to ask, more importantly, how to analyze this, and somebody that's looking out for your best interests. Ask them how they get paid, right? And I'm surprised. I'm going to say 20% of the people, it depends, month-to-month basis, sometimes half the people that are getting smarter, more analytical are finding me coming in. I'm very upfront. If you're a client, I'll give you an example. If you're a client of mine and I'm doing your Medicare, which means I'm actually writing the plan. It's the same you're going to get if you call the company and did it directly. The difference is you're going to get somebody that's objective, that's not just putting out one carrier, you get paid the same. It doesn't matter which carrier you're using. I will never compromise what's in somebody's best interest. As a CFP, I have a fiduciary duty to my clients to look after the best interest. And I tell people, I had somebody here yesterday, the advice I gave them, I go, understand the advice I'm giving you is coming from somebody that's not going to get paid, right? Technically, if I'm an insurance agent, I should be selling you something and I should be getting paid. I'm telling you not to do it. I'm telling you what I would recommend that you do. First choice, second choice, third choice. Find somebody that's going to give you options, help you understand it, to help you make a good decision. You want to have all the tools at hand to do that. And this gentleman, again, yesterday was like, I'm getting pushed into products by people. I'm not being given advice. So make sure you're getting advice to help you make good decisions around, because some of those decisions, especially with group retiree plans, are irrevocable. You can't go back and change it once it's made. And I've seen that happen to one person. They said, yep, I can get this money even after I retire if I don't use their benefits people. They elected to get a supplemental plan outside of it. Guess what happened? They lost that annual money that they were entitled to as a retiree benefit. They can't get it back. Once that's given up, it's given up. So think about those things as you're approaching, retiring from work with retiree benefits or your group plans. Now, if you need help with this, feel free, obviously, to reach out. We're here to help you. Certainly, if you're one of our clients, they know to give us a call anytime. The information should be below in the video. Please like and subscribe to this as always. It certainly helps, and make comments if there's other topics you'd like discussed. Helps me gear what's relevant information other than what I hear every day from people that call in and come in and meet with us. So thanks again for joining me. Bye-bye.